It's past 10 here in Istanbul and the weather is calm. Today's topic is going to be about postpartum depression, what every new mother needs to know. I'm Dr. Hauwa, by the way. Bringing a new life into the world is often described as joyous, but for many mothers, it also comes with unexpected emotional challenges. One such challenge is postpartum depression, a condition more common than you might think, yet still surrounded by stigma and misunderstanding. Let's explore what postpartum depression is, why it happens, and most importantly, how mothers can find the help they need. What is postpartum depression? Postpartum depression is a form of depression that occurs after childbirth. It affects about 10 to 20% of new mothers globally. Unlike the temporary mood swings known as the baby blues, which typically resolve within 2 weeks, postpartum depression can persist for months and significantly interfere with a mother's ability to care for herself and her baby. What are the symptoms of postpartum depression? Symptoms can vary from person to person, but often it include first, persistent feeling of sadness or hopelessness, severe mood swings, excessive crying, difficulty bonding with your baby, withdrawal from family and friends, loss of appetite or overeating, insomnia, or sleeping too much, fatigue or loss of energy, reduced interest in activities you once enjoyed, feeling of worthlessness or guilt, thoughts of harming oneself or the baby. Recognizing these signs early can make a significant difference. What causes postpartum depression? It doesn't have a single cause, but it is likely due to a combination of factors. First, we have the hormonal changes. After childbirth, the level of estrogen and progesterone drops sharply, which can trigger mood changes. Second is physical changes. Recovering from childbirth, adjusting to a new body image, and dealing with fatigue can take a toll. The third is emotional factors. Feeling of doubt about being a good mother, challenges in relationships, and lack of sleep can contribute to postpartum depression. The fourth is history of mental illness. Women with a personal or family history of depression or anxiety are at higher risks. How is postpartum depression diagnosed? A healthcare provider will typically use a screening tool such as the Edinburgh Postnatal Depression Scale alongside a clinical interview to diagnose PPD. It is important for mothers to be honest about their feelings even when it is difficult so they can receive the right support. What are the treatment options? The good news is that postpartum depression is treatable. These options include counseling or therapy. Talk therapy, especially cognitive behavioral therapy, it is highly effective. The second is medication. Antidepressant may be recommended, especially for moderate to severe cases. This should be discussed thoroughly with a healthcare provider, particularly if the mother is breastfeeding. The third is support groups. Connecting with other mothers facing similar challenges can be both comforting and empowering. The fourth is self-care. Encouraging mothers to rest, eat well, exercise, and accept help from loved ones is crucial. Supporting a loved one with PPD. If someone you love is experiencing postpartum depression, you listen without judgment. You let her express her feelings openly. You encourage professional help. Gently suggest she speaks to her doctor. Offer practical support, help with baby care, meals, or household tasks. You stay connected. Regular check-in makes a world of difference. On a final thought, postpartum depression is not a sign of weakness or a failure in motherhood. It is a real medical condition that requires attention and compassion. If you or someone you know is struggling, reaching out for help is the first and most courageous step. Motherhood is a journey and no one should walk it alone. Thank you and see you next time.